Did you just have a knee injury yesterday and you woke up this morning and your knee's a little bit puffy and swollen? Here's 3 things that you can start doing today to get rid of some of that swelling. The first thing we want to do is put compression around that knee joint. So what you want to do is grab a stocking, grab a compression sleeve, and you want to pull that up your leg from your ankle all the way over to your knee, up your thigh. And what we're trying to do here is create more pressure to help push some of that fluid into the lymphatic system and back to our heart to get out of the way. Then with the sleeve on, right, the best way, the absolute best way to get rid of swelling is light, non-painful movement. An easy way to do that for a knee is just gentle motion on a bike. So put the seat as high as you can until your feet are just touching the pedals, and use the other leg to drive the bike, and you'll notice you start to get a little bit of knee bend. And as the compression sleeve is helping keep it all tight, it's pushing some of that fluid out of the joint. And if you feel comfortable and it doesn't hurt, you can use the same leg that was injured to help get a little bit of contraction too, to pump the fluid out of that knee joint. We're gonna hop off the bike. The next bit we're gonna do is intensify, yes, using a voodoo band. Intensify that compression around the knee joint. So you're just gonna grab a simple voodoo band. It's black, it's stretchy, it's like a big rubber band. You're gonna start below the knee. What we're gonna do is just about 50% stretch, pin it against itself, and you're gonna work your way up, pulling the band across the knee to creating that intense compression, so that way, again, we're trying to push some of this fluid outside of the knee joint to help you restore your range of motion and eliminate some of the pain and discomfort that you might have today. Again, you're overlapping by about half each time. As you wrap around, just working your way up. And as you get closer to the top, be careful at the top of the kneecap. You might have to double up over there. And you're getting nice, even compression throughout the knee. Now, what you want to be mindful of is you don't go too tight. If your foot starts to go numb, you went too tight. We don't want that. So please, with caution, don't go too tight. Excellent. So we got some deep compression here. It's nice and intense. You're not going to keep it on too long. You're going to walk over to maybe some kind of rack. And all we're going to work on here, with support, to unload that knee, we're just going to work on some deep flexion, just to, as low as you can, that's comfortable, non-painful. Hold that. Again, you maybe use this leg to push yourself up. Don't worry about the strength right now. We're just trying to get rid of some of that swelling, because ultimately, you get rid of the swelling, you get rid of the pain, range of motion comes back. Those are 3 things you can start to do today to help get rid of swelling in your knee.